Introduction. Welcome to today's lecture on advanced topics in gastroenterology. In this comprehensive script, we will delve into the intricate details of various medical conditions and diseases related to the gastrointestinal (GI) system. By the end of this lecture, you will have a deep understanding of the pathophysiology, clinical features, diagnostic approaches, and management strategies for a wide range of GI disorders. Now, let's begin exploring each of the topics in detail. Malabsorption syndromes refer to a group of disorders that hinder the proper absorption of nutrients in the small intestine. We will explore the pathophysiology of each condition, including the autoimmune response triggered by gluten in celiac disease, the bacterial overgrowth seen in tropical sprue, and the pancreatic enzyme deficiencies in pancreatic insufficiency. Additionally, the clinical features specific to each syndrome will be discussed, along with the diagnostic approach involving serological testing, small bowel biopsy, and pancreatic function tests. Management strategies will include dietary modifications, enzyme replacement therapy, and potential surgical interventions. Gastrointestinal malignancies encompass a broad range of cancers affecting the esophagus, stomach, small intestine, colon, rectum, liver, and pancreas. We will explore the clinical presentations associated with each type, such as dysphagia in esophageal cancer and changes in bowel habits in colorectal cancer. Diagnostic techniques, including upper and lower endoscopy, imaging modalities such as CT scans and MRI, and the utilization of tumor markers will be discussed. The importance of accurate staging for prognosis and treatment planning, utilizing systems such as TNM classification, will also be emphasized. In this video, we will explore the characteristics, clinical manifestations, diagnostic procedures, and treatment options for gastrointestinal neuroendocrine tumors, GI NETs. We will discuss their unique features, how they can be diagnosed, and the available treatments for these relatively rare neoplasms. In the fourth section of the video on gastrointestinal disorders and semiology, we will be focusing on achalasia and eosinophilic esophagitis. These two distinct esophageal disorders affect swallowing and cause dysphagia. We will discuss the underlying pathophysiology, clinical features, diagnostic criteria, and various management strategies for these conditions. Acute mesenteric ischemia is a life-threatening condition resulting from reduced blood flow to the intestines. We will discuss its causes, including vessel occlusions and venous thrombosis, risk factors such as cardiac diseases, and diagnostic methods like CT angiography. Urgent management involves revascularization and supportive care. In this section, we will explore the pathophysiology, clinical consequences, diagnostic methods, and management approaches for portal hypertension and its complications. Topics covered include variceal bleeding, ascites, Doppler ultrasonography, and interventions such as beta blockers, endoscopic variceal ligation, TIPS, and paracentesis. In this section on autoimmune enteropathies, we will explore conditions like autoimmune hepatitis, primary biliary cholangitis, and autoimmune pancreatitis. We will discuss their clinical manifestations, diagnostic criteria, and treatment options. Topics covered include GI symptoms, diagnostic tests, and immunosuppressive therapies for optimal patient outcomes. The advent of genomic medicine has revolutionized the field of gastroenterology, enabling personalized approaches to diagnosis, treatment, and risk assessment. We will explore the role of genetic testing, both germline and somatic, in various gastrointestinal disorders. Colorectal cancer will be a focal point, including hereditary polyposis syndrome such as familial adenomatous polyposis, FAP, and Lynch syndrome. Additionally, we will discuss the genetic factors associated with inflammatory bowel disease, such as Crohn's disease and ulcerative colitis. The implications of genomic medicine in risk prediction, surveillance protocols, and targeted therapies will be thoroughly examined. Drug-induced liver injury, DILI, is an adverse drug reaction resulting in liver dysfunction and damage. We will delve into the various mechanisms by which drugs can cause liver injury, including direct hepatotoxicity, immune-related reactions, and idiosyncratic responses. Clinical features may vary widely, from asymptomatic transaminitis to severe hepatocellular jaundice. Diagnostic challenges associated with DILI will be discussed, focusing on the exclusion of other potential causes and the utilization of liver function tests and hepatobiliary imaging. Management strategies encompass prompt discontinuation of the offending agent, supportive care, and potential liver transplantation in extreme cases. In this section, we will discuss zoonotic gastrointestinal infections, which are infections transmitted from animals to humans. We will cover their epidemiology, clinical manifestations, diagnosis, and management, focusing on pathogens like Salmonella, Campylobacter, and E. coli. In this section, we will explore hereditary gastrointestinal polyposis syndromes, which lead to the development of multiple polyps in the GI tract and an increased risk of colorectal cancer. Specifically, we will examine two significant syndromes, familial adenomatous polyposis, FAP, and Lynch syndrome, hereditary non-polyposis colorectal cancer. We will discuss the clinical features, diagnostic criteria, including genetic testing, and management options for these syndromes. In this video, we will cover hepatopancreatobiliary emergencies, including acute liver failure, acute cholangitis, and acute pancreatitis. We'll discuss their clinical presentations, diagnostic workup, and immediate management, highlighting the importance of prompt intervention for these life-threatening conditions. We'll also explore the various tests, imaging techniques, and invasive procedures used to diagnose and treat these emergencies. In conclusion, this lecture has covered a wide range of advanced gastroenterology topics, providing detailed insights into complex medical conditions. Staying updated with the latest research is crucial in this rapidly evolving field. We hope this comprehensive script has broadened your knowledge and sparked your curiosity.